Morning, it's April 1st, and here is your update on the coronavirus and happy April Fool's Day. Let's go over a couple things that are new about the outbreak. Let's talk about what we're doing to change things up and what has changed since March 24, last time I gave an update. So, let's talk about something about the coronavirus. The numbers are easily accessible, so I don't think it's really worth reviewing that. Let's talk about risk factors. Um, the number one thing, well, not number one of the first risk factors is male gender. So, sorry, guys in the room. Seems like we are behind on that one. Not much more to say about that. Age. It still looks like that the elderly are getting more critically ill, but who knows, right? There seems like there's also young people getting critically ill, and I talked about that last time. The next thing would be smoking. Of course, that's a risk factor for a disease that attacks your lungs. You don't want to be a smoker. So this thing gains access to your body through the mucosal membranes and then migrates its way down to your lungs where it attacks a certain cell that produces a substance called surfactant. And surfactant is necessary because what it does is it's a lubricant that allows your lungs to expand. It makes them slick. And so they can expand and you can easily um, inspire. And so if you're a smoker, that system is damaged. Already some of those cells are damaged and you're behind already with that. So there's no better time to quit than now. I don't mean to cause you a bunch of stress or cause you a bunch of worry, but it's the truth. And so I just feel like it's my duty to tell you that. And here's a resource. Here's what you can do about it. It's hard to quit. I've talked to many people about quitting smoking, but I've had a few people that have been successful using our health coaches. The health coaches is a free service if you're a patient to our clinic that are RNs. They are RNs, and they work in the clinic and also over in the hospital, and they help with a number of different chronic disease states. They are very willing and able with their time to talk to you and resources and to encourage you to quit your smoking. So please call up to the clinic and we'd be happy to set you up with Lori Ainsley or Nicole, and they would be happy to talk to you about those things. Another thing that the health coaches have helped a lot with is another risk factor for this is obesity. So I was reading last night that people who are younger that are becoming more critical with it seem like there's also an obesity pattern with it. So let's keep an eye on that, and also let's try to take off those 5 pounds. Everybody's carrying it around, if we're honest with ourselves, and so let's try to avoid those carbohydrate-rich foods. Those are things that are easy to pack on weight with. So let's eat some more protein and let's eat some fiber-rich vegetables. Maybe get out and do some walking. I'd like you to do walking to where or light cardio, and let's do that to where we're not able to quite or we're almost not able to complete a sentence if we were to be working out with a partner. That's what we're looking for. That's an easy way to judge your heart rate. Okay, next thing, hypertension and coronary disease are risk factors. Not a whole lot you can do about that if you have those other than try to take that weight off, stop the smoking. Those also play into hypertension and coronary disease. And then also, let's just make sure we're taking our high blood pressure medications. Let's get refills on those. If you're able to get a 90-day script for that we don't have to go in as often to the pharmacy, that's a great idea. Another risk factor is renal disease. So let's protect your kidneys. Hydrate up as well as you can, and that's just I guess common sense with this, but it's something that I don't do a very good job of is drinking water throughout the day. So let's try to keep our kidneys really well hydrated. There may be a couple other of these risk factors that I'm missing, but that is what I wanted to talk about here. Okay, so what's changed since March 24 to April 1? Something that I'm definitely very optimistic about and encouraged by is if I toggle my screen over here to a site called World Meter, and if you go to the World Meter and click on coronavirus and then click on the United States, it's pretty easy to navigate. You can come down and see a pretty realistic or up-to-date information about what the caseload is looking like what's by state. And so you can see it broken down by state or broken down by country, and then you can see where we are. Like I said, it's a little laggy, but it does a good job. It's almost impossible to have exactly up to minute information. So if you scroll down all the way to the bottom, you'll see the individual states that are listed in the United States, and we have at the bottom is South Dakota, and then we have Alaska, Wyoming, North Dakota, West Virginia, and then there comes the Cornhuskers. There's Nebraska at 177 cases with 3 total deaths. Maybe that's not exactly true as of this morning of April 1st or when you hear this, um, April 1, April 2, April 3, but I think we're doing a great job. Maybe that's just because we haven't seen a peak yet, and the peak is predicted to be coming towards the end of April around here. So we have a little bit more time to keep doing a good job, but I just want to encourage you that we are doing a very good job. Stay home and try to just isolate as much as possible. And so that leads me in the next thing. Well, actually, there's one more thing that I'm optimistic about. And the top Google search, one of the top Google searches, how to cut was how to cut a man's hair. So I think that's going to be it's encouraging, but it's also going to be interesting. So we have people out there that are thinking long and hard about staying home and going to the crazy end of trying to cut their own hair. Okay. Um, Okay, so what are we doing at SMC and what am I doing in my household? Let's just go through a few of those things as it's probably pretty helpful. So we're going to do something a little different now. Let's go for a little tour. I'm going to click the pause button. It might get a little choppy, but let's go for a tour and I'll show you. Okay, forgive me with some of the angles and forgive me with if you can't hear me that well, but the first thing that we're doing that you can obviously see here is that I'm wearing a mask. And so as of yesterday, any employee within the facility, when you encounter them, they will have one of these surgical masks on. Um, there's been some criticism in the news. Does that do any good at all? And I think our approach to it is if we're not using a whole lot of PPE up and everybody's trying to use one of these a day, I don't think it's going to harm anything. If we are shedding the virus, if we're asymptomatic, it's known that you shed the virus on days -1 and -2. So that's before you start showing symptoms. And so I think, and you shed it through your breath is what we're finding. So of course I think this has to help. And so that's one of the measures we're taking. Another thing that we're doing here is that we have a hallway where there's a hallway with sick individuals. So if people come in for those symptoms of sore throat, cough, etc., they are going to be, make sure nobody's in the way here. They're going to be coming down this hallway behind me. And so these rooms behind me is where we will be seeing those patients. And they will be entering from this doorway here. Okay. And then as we go walk over here to this side, this is going to be the clean side where we have patients come in where their charts are tagged with the green dot. They'll be coming through this doorway here. And then we will be going down this hallway. And this is where we are going to see people with things such as an ankle sprain or high blood pressure refills or acid reflux, any of the things that you come into the clinic for that would be considered to be healthy. Okay, let's move it to a different spot. Okay, as you can see behind me, there's a little, there we go, there's a little desk right here. And as you enter the clinic from right here, you will come to this little desk right here, and this is where we'll have your temperature taken, and that'll be flagged and marked on your shirt or like on a sticker that goes on your shirt. Okay, here we are in one of the hallways, and I've come across the UV light sterilization project that we have going, where we have this, it's kind of hard to see in the video, but we have this large UV light emitting device that will fry any of the coronavirus that is left in rooms. And so after we see sick patients, we'll deploy this thing into the room, turn it on. How long does it stay on for, Stacey? It stays on for 10 minutes and does a good job of cleaning and trying to get rid of all the viruses there. We can use that in the clinic, we can use it in the ER, we can use it in the hospital, down in the care center, wherever we need it. Here we are back in my office. I took the mask off so maybe you can hear a little bit better. Sorry if that was difficult to hear what I was saying, but we're taking temperatures at the front door. We're distancing when we check in people into the front. We have a clean hallway and a dirty hallway, I guess you could say, where we have sick patients and healthy patients. We have the Clorox room light that is used in the rooms. It is really cool. It's really exciting. It's like a really intense tanning bed, put it that way. So what am I doing at home to try to keep my family healthy and keep my home a sterile environment, which I think you should start doing as well, especially as the peak is predicted to be here in another couple of weeks towards the end of April, early part of May in Nebraska. First thing is I'm trying to work out daily. I have no idea if this helps, but I'm recruiting soldiers for the battle, I guess you could say. So just get them lungs ready to go. let's get some cardio in every day. It doesn't have to be a lot, but let's try to get some cardio in. If anything, it helps manage my stress levels too. Anytime we get a delivery to the house, Amazon packages, it looks like this coronavirus will live on cardboard for up to 24 hours. And so when you get that Amazon package, if you don't need it right away, let's let it sit on the porch. If you're in an area where you're worried about it getting swiped, which is unfortunate, let's go ahead and move it into the garage. Wash your hands after you handle it, or go ahead and put it in your front porch, anywhere where you can just leave it there for a day or two. Just let that thing sit there for a while, and then open it outside. Open it outside, discard the cardboard Amazon back box outside, and then if it's something that can be spritzed, go ahead and spritz it with some cleaner and wipe that thing down. Let's keep your inside your house as sterile as possible and a safe zone. Groceries, that's a huge thing. And there's been some videos out on social about how you should handle your groceries. A lot of people give this an eye roll, but I think it's legitimate. I think we should be careful with that and protecting ourselves. And so let's find a good way to keep them and leave them outside, wipe them down when we come in the house, um, and do as best you can there. As far as if you work in an environment that is healthcare or somewhere where you are exposed to this a lot or there's a lot of people, consider changing your clothes at work. I will come in wearing street clothes and change into scrubs, work my shift, and then at the end of that, I'll change back or I'll shower because we have a locker room, shower, and then change back into my street clothes and head home. That's just trying to keep all that away and not launder um, those things in your house if you can help it. If you are going to do that, let's just go into the house right. If you don't have the ability to change at work, let's say, let's go into the house right after work. Go right into your laundry room or your basement, your garage if it's connected to your house. We don't need anybody streaking. And let's change, and then go inside and shower, or go ahead and change into your clean clothes. Sterilize your steering wheel. Something you don't think about, but you put your hands on that steering wheel. So let's get a little hand sanitizer. Maybe keep a small bottle in your jar if you're fortunate to have a lot of it. A small bottle of it in your car if you're fortunate enough to have some of it, enough of it. And let's sanitize that hand, the shifter, the steering wheel, things like that. Something else that we're doing is that we're not having friends come over to the house. Reason being is that, as I touched on earlier, why we're wearing the masks. You may be shedding the virus just in your breath on days -1 or -2. So day 0 is the day you come down with symptoms. Day -1 and day -2 are days 1 and 2 before you have symptoms. And so it's shown that you are shedding the virus in your breath alone. And so try to keep people, even if people feel fine, let's try to keep people away for just the next month, and let's just be tough about it and stay the course. Let's not give in. Let's not let our guard down. Absolutely no handshaking. There's no need for that. Um, I guess the last thing that I'm doing. Let's pause this. About that. We're just gonna finish the video, and last thing that I'm doing is I'm trying to get out and play some golf. And today's going to be a nice day, so I'm gonna get out and play golf. And my new favorite partner to play with is my daughter because she gives me a putt, any putt that's within 10 feet. She says pick it up. So that's fun. Have a good day. Keep doing the social distancing. Let's not let our guard down. Keep doing a great job, Nebraska, because we are low on the list. We haven't seen this thing yet. We're going to see us peeking into here shortly. So just know that it's still coming and don't let your guard down. All right, we'll talk to you soon.